Hi, I'm Garvin. This video is on Apidra. So what is Apidra used for? It's used for diabetes in adults and children aged 6 years and older. And how does it work? Apidra SoloStar pre-fill pens and Apidra penfill cartridges contain the active ingredient insulin, glulisine. They are used to treat diabetes. People with diabetes have a deficiency or absence of a hormone manufactured by the pancreas called insulin. Insulin is the main hormone responsible for the control of sugar or glucose in the blood. People with type 1 diabetes need to have injections of insulin to control the amount of glucose in their bloodstream. Insulin injections act as a replacement for the natural insulin and allow people with diabetes to achieve normal blood glucose levels. The insulin works in the same way as natural insulin, by binding to insulin receptors on cells in the body. Insulin causes cells in the liver, muscle and fat tissue to increase their uptake of glucose from the bloodstream. It also decreases the production of glucose by the liver and has various other effects that lower the amount of glucose in the blood. Apidra contains a type of insulin called insulin glulisine. This is known as a fast-acting insulin. When it is injected under the skin, it starts to lower blood sugar within approximately 10 to 20 minutes, and its effects last for around 3 to 4 hours. This type of insulin should be injected up to 15 minutes before, or if necessary, immediately after a meal, to control increasing blood glucose levels after eating. Insulin glulisine is usually given in combination with intermediate or longer acting types of insulin, which provide control over blood glucose throughout the day. Keeping your blood glucose level as close to normal as possible and not too high or too low significantly reduces the risk of developing late-stage diabetic complications, such as problems with your nerves, eyesight or kidneys. So how do I use it? Your doctor or diabetes specialist will teach you how to administer your insulin injections correctly. Apidra injections are given under the skin of the abdomen, thigh or upper arm. You should take care to ensure that the injection does not enter a blood vessel. The injection may start to work at different speeds depending on the site you use and various other factors such as if you've been doing exercise. In general, injections into the abdomen start to work quicker than those given in other areas. You shouldn't massage the injection area after administration of the injection. Each time you inject your insulin, make sure you use a different site. This helps to prevent the skin thickening and pitting, which can occur if the injection is repeatedly given in the same site. You should measure your blood sugar levels every day when using insulin injections. The dose you need to inject each time will depend on your blood sugar levels, what you are going to eat, and if you have been doing or will be doing exercise. Your insulin requirements may increase when you are ill, especially if you have an infection or fever. Your insulin dose may also need adjusting during periods of emotional disturbance, or if you increase your physical activity or change your usual diet. Insulin requirements may be reduced if you have impaired kidney or liver function. It is not to be used in low blood sugar levels or hypoglycemia. Apidra is not recommended for children under 6 years of age, as it has not been fully studied in this age group. This medicine should not be used if you are allergic to one or any of its ingredients. If you feel you have experienced an allergic reaction, stop using this medicine and inform your doctor or pharmacist immediately. Pregnancy and breastfeeding. So insulin glulisine has not been adequately studied in pregnant women and should be used with caution during pregnancy. However, studies in animals have not revealed any differences between insulin glulisine and human insulin with regards to pregnancy. Human insulin does not cross the placenta and provides no risk to the developing baby. It is not known if insulin glulisine passes into breast milk, but insulin in general does not. Even if it did, it would not affect a nursing infant because insulin is not absorbed when taken by mouth. There is no risk to nursing infants from insulin taken by the mother. So the side effects. Medicines and their possible side effects can affect people in different ways. The following are some of the side effects that are known to be associated with this medicine. Just because a side effect is stated here does not mean that all people using this medicine will experience that or any side effect. So the first would be low blood glucose level or hypoglycemia, redness, swelling or itching at the injection site, allergic reactions such as skin rash or itching, hives, chest tightness, shortness of breath. Rare side effects would be skin thickening or pitting if injection given too frequently into the same site. So the side effects may not include all of the side effects reported by the medicine's manufacturer. For more information on all possible side effects and risks associated with this medicine, please read the information leaflet provided or talk to your doctor or pharmacist. So how can this medicine affect other medicines? Insulin itself doesn't affect other medicines. However, it is important to be aware that many medicines can affect blood glucose levels and can therefore change your insulin requirements. For this reason, people with diabetes should always seek advice from their doctor or pharmacist before taking any new medicines or stopping existing medicines. The following medicines may decrease blood sugar levels. If you start treatment with any of these, your insulin dose may therefore need adjusting. ACE inhibitors. These can sometimes cause unpredictable drops in blood sugar. Anabolic steroids, such as testosterone. Anti-diabetic medicines taken by mouth. Disopyramide, the fibrates, which is such as gemfibrozole. Fluoxetine, which is Prozac. Monoamine oxidase inhibitor antidepressants, such as phenelzine. Octreotide, large doses of salicylates, which is aspirin. The small pain-relieving doses do not normally have this effect. Beta blockers, e.g. propranolol, including eye drops containing beta blockers, can mask some of the signs of low blood sugar, such as increased heart rate and tremor. They also prolong episodes of low blood sugar and impair recovery back to normal glucose levels. The following medicines may increase blood glucose levels. If you start treatment with any of these, your insulin dose may therefore need some increasing. Some antipsychotic medicines, such as chlorpromazine and olanzapine, the corticosteroids, hydrocortisone and prednisolone, danazole, the diuretics, such as thiazide and bentofluozide, isoniazid, lithium, protease inhibitors, such as ritonavir, somatriptan, which is a human growth hormone, estrogens and progestogens, such as those in the oral contraceptives, may affect blood sugar levels, and women taking these may need small adjustments up or down in their insulin dose. So how do I store Apidra? The pre-filled pens, unused penfill pens should be stored in a refrigerator at 2 to 8 degrees Celsius. You do not freeze. Keep the pen in the outer carton to protect from light. Once in use, the pens should be kept out of the fridge below 25 degrees. They can be used for up to 28 days. The pen cap must be put back on the pen after each injection in order to protect from light. The pens should not be stored with the needle attached and should not be kept in the fridge once in use. And cartridges. Before use, cartridges should be stored in a refrigerator at between 2 and 8 degrees Celsius. Do not freeze. Keep the cartridges in the outer carton to protect from light. And once in use, the pen with the inserted cartridge should be kept out of the fridge below 25 degrees. It can be used for up to 28 days. The pen cap must be put back on the pen after each injection in order to protect it from light. The pen should not be stored with the needle attached. Make sure all medicines are kept out of reach of children and avoid exposing them to excessive heat or direct sunlight. So if you have any other questions, you can contact me through the Life Pharmacist on the website. You can email me or just call into Lynch's Pharmacy in Broaddale in Douglas. Thank you for watching.